Namaskara, I am Dr. Sunita Rana Agarwal. I am a genetic surgeon and an ophthalmic surgeon, and I practice at Dr. Agarwal Hospitals, 15 Eagle Street, Bangalore 25. Retinal detachment. The retina is just a nerve layer, an extension of the brain if we can imagine that. So the brain is sent out a million axons and then they've broken up into a very thin membrane called the retina. It does not get essential blood supply. So for its blood supply, it has to rest on the rest of the eyeball. When it does not rest on the eyeball, we call it a retinal detachment. Most often cause for retinal detachment is myopia. In myopia, the eyeball is stretching big and big. The retina is not stretching fast enough, so small holes will develop in it. The fluids of the eye will go under the hole and detach the retina. Whenever there is a retinal detachment, that part of the retina is not getting its nourishment, therefore he is not seeing. So the first thing the retinal detachment patient will tell you is that I'm not seeing in this part or this part. But once it becomes a complete detachment, then they're not seeing with that eye completely. The second most important cause for retinal detachment is diabetes. So as diabetes keeps progressing, it will produce proliferation, retinal hemorrhage, vitreous hemorrhage, and then retinal detachment. How do we treat this condition? Retinal detachment is usually treated with a surgery. However, today in our hospital, we do have another way out. We give the patient injections where we take one drop of blood from the patient's finger, make the patient's own fetal healthy DNA, RNA and stem cells, give it back as injections to the patient. Along with that, we try to help increase the energy of the eye by giving laser treatment to the eye and by giving magnetic treatment to the eye. Here we give a magnet which is placed inside a silicone plug and placed inside the lacrimal canal. It's not really a surgery, but it's just putting the magnet lie over here, and within a week or so the retina reattaches. The essential cause for retinal detachment, therefore, is that the energy in that eye has become less. There's no gooey that is sticking the retina to the back parts of the eye. It's energy. So energy we give back by light treatment, by magnetic treatment, and by the patient's own autologous immune booster therapy.